President Biden says his administration is prepared to roll out Pfizer booster shots to tens of millions of Americans who are now considered eligible. Overnight, the CDC director, Dr. Rochelle Walensky, signed off on a series of recommendations made by an advisory committee, agreeing that boosters should be offered to people 65 and up and also to people 18 and older if they have underlying health conditions. But in an unusual twist, she also overruled the committee, putting back in the recommendation for a third dose to individuals whose jobs might put them at risk, like healthcare workers.
People who have significant exposure need to be protected from the virus, and so she did the right thing. It's in line with what the FDA had recommended, so it's certainly not radical, but it makes sense, and I agree.
Moderna has now submitted its own data to the FDA, seeking permission for a booster shot at half the dose of its first 2 shots. Johnson & Johnson is also expected to do so soon. About 25% of Americans who are now eligible to be vaccinated, though, still have yet to get their first dose.
So what happens if you qualify for a Pfizer booster shot, but you got Moderna's or Johnson & Johnson's vaccine? Can you mix and match vaccines when it comes to the boosters? Matt Gregory with our National Verify team digs into it.
The dominance of the Delta variant across the country, combined with fears of waning immunity from the vaccines, has got a lot of people looking into and talking about booster doses. So let's verify. Does it matter which vaccine you got when it comes to getting a booster? Our sources are 2 vaccines experts, Dr. William Moss from Johns Hopkins University, Dr. Matthew Freeman from the University of Maryland School of Medicine, and the Food and Drug Administration. And all of our sources say, yes, it does matter.
So the only FDA-approved booster could be from Pfizer. None of the other vaccines can be approved by the FDA for boosters.
Those pharmaceutical companies have not submitted, the data, because they're still collecting it, on whether or not an additional dose is needed.
Regarding the Pfizer booster shots, an FDA panel did make a recommendation about boosters, but it wasn't universal.
Their recommendation is that these additional doses be considered for individuals older than 65 years of age, and individuals either at high risk of disease or high risk for exposure.
If you're wondering why the FDA panel wouldn't recommend boosters for all, both of our experts say the latest data shows the current vaccines still perform well.
The protective effectiveness of the vaccine against hospitalization and death still was above 90%.
Almost no one is going to the hospital who's been vaccinated and then infected.
So yes, in the case of boosters, it will matter which vaccine you originally received. But the data so far shows the vaccines still perform remarkably well despite the Delta variant.